Greg Herbrook knew 6.5 million of his birds needed to die, and fast. But the CEO of Herbrook's poultry ranch wasn't sure how the third-generation family egg producer, one of the largest in the U.S., was going to get through this round of avian flu, financially or emotionally. One staffer broke down in Herbrook's office in tears. The mental toll on our team of dealing with that many dead chickens is just, you can't imagine it, Herbrook said. I didn't sleep. Our team didn't sleep. The stress of watching tens of thousands of sick birds die of avian flu each day, while millions of others wait to be euthanized, kept everyone awake. In April 2024, as his first hens tested positive for highly pathogenic avian influenza HPAI H5N1, Herbrook turned to the tried and true USDA playbook, the stamping out strategy that helped end the 2014-2015 bird flu outbreak, which was the largest in the U.S. until now. Within 24 to 48 hours of the first detection of the virus, state and federal animal health officials work with farms to cull infected flocks to reduce the risk of transmission. That's followed by extensive disinfection and months of surveillance and testing to make sure the virus isn't still lurking somewhere on site. Since then, egg farms have had to invest millions of dollars into biosecurity. Employees shower in and shower out before they start working and after their shifts ends to prevent spreading the virus. But none of that has been enough to contain the outbreak that started 3 years ago. This time, the risk to human health is only growing, experts say. 66 of the 68 total human cases in the United States have been just since March, including the first human death in this country earlier this month. The last 6 months have accelerated my concern, which was already high, said Dr. Nahid Badalia, an infectious diseases physician and the founding director of Boston University Center on Emerging Infectious Diseases. Controlling this virus has become more challenging, precisely because it's so entrenched in the global environment, spilling into mammals such as dairy cows and affecting 147 million birds in commercial and backyard flocks in the U.S. An orange tabby cat crouches to eat food in a bowl. Your health, what to know about protecting your cat from bird flu, because laying hens are so susceptible to the H5N1 virus, which can wipe out entire flocks within days of the first infection. Egg producers have been on the front line in the fight against various bird flu strains for years now, but this moment feels different. Egg producers and the American Egg Board are begging for a new approach. Many infectious disease experts agree that the risks to human health of continuing current protocols is unsustainable because of the strain of bird flu driving this outbreak. The one we're battling today is unique, said David Swain, the former lab director of the U.S. Department of Agriculture USDA, Agricultural Research Service ARS, Southeast Poultry Research Laboratory CEPRL, and a leading national expert in avian influenza. It's not saying for sure there's gonna be a pandemic of H5N1, Swain said, but it's saying the more human infections, the spreading into multiple mammal species is concerning.